when I hand it over to you, I guess.
Sounds great.
All right, all set.
Okay, everyone, hello, and you are very welcome to our October webinar event. My name is Devin Ramey, and I am a lecturer in behavior analysis here at Queen's University, Belfast. On the behalf of the Center for Behavior Analysis, I am honored to introduce to you Dr. Mandy Rispoli. Dr. Rispoli is a board-certified behavior analyst, doctoral level, and a professor of special education at Purdue University. She is the co-editor-in-chief of the Journal of Positive Behavior Interventions and serves on the editorial board for several other peer-reviewed journals. Dr. Rispoli has published over 120 peer-reviewed journal articles and book chapters on behavioral interventions for children diagnosed with autism and other developmental disabilities. Dr. Rispoli's scholarship is built upon sustained university community partnerships to improve meaningful involvement of teachers and caregivers in functional behavior assessment and intervention to promote positive outcomes for these children. Her research focuses on improving the efficiency, effectiveness, and feasibility of functional behavior assessments and function-based interventions in educational settings. She is also interested in innovations to professional development for teachers of young children on the autism spectrum that present with challenging behavior. I have personally been following Mandy's research for quite some time now since I began my own academic career, so I'm really excited to have her here to speak to us today. But before we get started, there's just a few housekeeping issues. So there will be four attendance checks to click on. You must have at least 3 of those 4 attendance checks to receive your CEU. When the attendance check shows up on your screen, it will be at the top of your screen. There will be a banner, and you must click the button that says I'm here to check in. You do not have to write I'm here in the chat box, just click on the banner. If there are any issues, however, you can always contact Chris from Behavior Live and he will help you out. So please do not stress about these attendance checks. I just want you to focus on the content. The second thing is if you do have any technical issues, the easiest way to potentially solve that issue is just to hit refresh on your browser. That will likely solve the problem. But if you are continuing to have issues, just write in the chat box if you're able, and Chris will also be able to help you. The last thing is if you do have any questions for Mandy, she will be responding to questions at the end of her presentation. And there is a questions box at the bottom of your screen. And if you click on questions, you can write a question to Mandy and then click ask the speaker to submit your question. And at the end, we will be going through those questions. And I will try to monitor the chat box as well, but the easiest way to get your question answered is to write to the question box. So I think that is it, and I will hand it over to you, Mandy.
Great, thank you so much. Welcome, everyone. I am going to just organize myself here so that you can see my slides. Great, and you should be able to see this now. Yes, yes, okay, great. Thank you so much, Devin, for having me here today. I'm excited to present to such a global audience. I was looking through the attendees and folks are everywhere around the world. So it's really one of the silver linings of technology, right, is that we can get everybody together. So I'm so excited to be here with you all today. Today I'm going to be talking about trial-based functional analysis, and specifically the applications of this technology in natural contexts. As Devin said, feel free to ask questions. I am not a great multitasker, so I will focus on the presentation at this point, but we'll be sure to have some time at the very end to go through your questions. I also include my email address at the end of the talk, and so if we don't get to your question or you'd like to follow up with me on anything, feel free to contact me that way as well. Okay, so I want to begin by just providing an overview of what functional assessment is. And so for individuals, particularly individuals with developmental disabilities who present with challenging behavior, particularly challenging behavior that is persistent or resistant to intervention, challenging behavior that puts the individual safety or other safety at risk, those types of behaviors typically require individualized function-based intervention. Function-based meaning that we are looking to see what is the communication that the individual is trying to communicate through their challenging behavior. So what's the communicative function of their challenging behavior? And once we know what the individual is communicating, then we can alter the environment so they have less motivation to communicate that, or we can teach them additional skills so that they have better ways to communicate their message instead of problem behavior. And a functional behavior assessment, or FBA, is a process where we can learn what it is that the individual is communicating with us. A functional behavior assessment is a process that leads directly to the development of a function-based intervention. So functional behavior assessment and function-based intervention go hand in hand. And we know that behavior support plans that are developed from the results of functional behavior assessments are more likely to be effective and more likely to be efficient in reducing challenging behavior. So that's functional behavior assessment broadly. One way that we can ascertain the communicative function of an individual's challenging behavior is through a process that's called a functional analysis of challenging behavior. And this allows us to systematically manipulate variables in the environment so that we can determine what variables evoke or occasion challenging behavior and what variables in the environment serve to maintain or reinforce that challenging behavior. So because we're systematically testing these antecedents and these consequences around challenging behavior, we're able to have more accuracy in determining the function of that individual's behavior. So in other words, we have fewer false positives. So we might, if we're just looking to see what's correlated in the environment with the behavior, then we might end up falsely assuming that that other variable that's correlated actually has some sort of causal relation with the challenging behavior, and it may not. They're just coincidental. A functional analysis reduces the risk of those false positives because we're actually looking to see what variables turn on the behavior and what variables turn off the behavior. And just like a functional behavior assessment, a functional analysis leads to increased intervention precision, which means it's more likely to be effective and it's more likely to be efficient. The other piece of a functional analysis is that it allows us to be more confident in what it is the individual is communicating, so we can honor the individual's voice, which will help them to then get their wants and needs met through more socially appropriate behaviors. So I want to spend just a few minutes providing an overview of some of the functional analysis models that exist. One is a traditional functional analysis. Sometimes this is called an analog functional analysis. And this is the model that was developed by Iwata and colleagues. And typically what happens in this model is sessions are between 5 and 15 minutes. And each session assesses for a specific communicative function. So we might be looking to see if the individual's problem behavior is maintained by access to attention. We might check to see if the individual's problem behavior is maintained by negative reinforcement in the form of escape, often escape from task demands. We might look to see if the individual's problem behavior is maintained by preferred object or activity. We call that the tangible condition. And then we will have a control condition, which is either a play condition where the individual has lots of attention, no task demands, wonderful fun things to engage with, and we would not expect to see challenging behavior occur in that condition. So it serves as a control against these other social conditions. And then in some cases, we also run what's called an alone or an ignore condition. And that serves two purposes. One, to test for behavior that might be automatically maintained. And two, it can also serve as a control condition. So within each of these 5 to 10 minute sessions, we repeatedly present different antecedents that we think, or a single antecedent that we think is going to evoke problem behavior, or we want to test to see if it does evoke problem behavior. And then a specific consequence to see if that turns off the problem behavior or serves to maintain that problem behavior. And we typically do this in a massed trial format. Antecedent, look for the behavior, and provide a consequence over and over and over within that 5 to 15 minute session. And we measure the occurrence of challenging behavior during that session, typically as either a rate of challenging behavior per minute or as a percentage of intervals with the target behavior. the percentage of intervals is really helpful for problem behavior that doesn't have a clear start or stop, or that occurs at such a high rate that we can't actually record each instance. So we get an estimate using an interval sampling system. And then we take those data and we compare them across those different social situations. And we look to see what is the social condition that has the highest levels of challenging behavior. And that is likely what the individual is communicating through their challenging behavior. Other functional analysis model, and then we present the data typically in a traditional functional analysis through single case graphs. This is what's called a multi-element design, where we plot several different conditions all in one graph, and we're looking to see separation of responding across each of those conditions. So here, each social condition is correlated with a data marker, so a triangle or a square or an open circle, and then a line connecting those data markers. And we look for separation in responding across those different data paths. So if we were to look at this graph, we might conclude that this challenging behavior appears to be maintained by escape from demands, which is represented by the closed triangles. Another model of functional analysis is called the brief functional analysis model. And this is where we continue to do sessions that are 5 to 15 minutes. Usually we kind of shift more towards the shorter duration, so maybe 5 minutes. And we just probe each condition one time. So we're continuing to do the mass trial approach, antecedent behavior consequence, over and over during that 5 minutes, but we only probe each condition once. And then we look for the condition that has the highest levels of responding. We may choose to probe that one more time, and then we will try to implement an intervention to see if we can immediately turn off or reduce that challenging behavior. And of course, some advantages to this model is that we end up spending less time in functional analysis and we can get to intervention more quickly. One of the downsides is we don't have as much data, so we may go into intervention and have an intervention that's not effective because we weren't able to determine the function of the individual's behavior. Another functional analysis model is the latency model. So this is where we're looking at time until challenging behavior. So we might present an antecedent and then we'll wait to see how long does it take before that antecedent evokes problem behavior. And then we also have a pairwise functional analysis, which we're only looking at two conditions, a control and then what we think might be maintaining that problem behavior. So here you can see we have an escape from demand condition and then a play as control. And we see a nice separation in responding across those conditions. So we can conclude that the challenging behavior is maintained at least in part by escape from task demands. We haven't tested all of the social functions, so we can't conclude that this is the only function, but we can conclude that this is a communicative function of that individual's responding. And now we can develop an intervention to help reduce that challenging behavior. Recently, there's been a lot of attention also to the interview-informed synthesized contingency analysis, or ISCA. And this functional analysis approach looks at taking those different social functions and pulling them together, because the thinking is that individuals might not want just escape or just attention, but perhaps they want to escape this task to get attention from a preferred adult. So in other words, functions may work together to create sort of a super function of challenging behavior. And so in this model, there's a lot of data that's collected before the functional analysis through interviews and reporting. And then we compare an aggregated or synthesized test condition where we might have, for example, escape, tangible, and attention all combined. And we compare that to a control condition. And so what we're able to learn here is, does this combination of antecedents and reinforcers maintain challenging behavior? So I want to talk a little bit about how I got involved in trial-based functional analysis, and then I'll show you some data on what trial-based functional analysis looks like. So several years ago, I was called into a school to work with two young children who had developmental disabilities who engaged in problem behavior throughout the school day. And we'll call them Lauren and Den. This is a paper that was published in Journal of Positive Behavior Interventions in 2013. And so I came into the school and I was really excited to meet these kids and help them through their challenging behavior. So the first thing I did was a traditional functional analysis. And you can see the results for Lauren and the results for Dennis here. And what you see in both of these graphs is that challenging behavior was either non-existent or occurred at very low levels. This was in complete contrast to the school report that these kids were engaging in significant challenging behavior all day, every day. So we call this a functional analysis fail. So functional analysis actually served to treat challenging behavior here. So when I pulled the children into the conference room to run this assessment, they had no challenging behavior. And so I started to think, okay, why is this the case? Why, for kids who are presenting with such high rates of problem behavior, are we not seeing it when we go to assess it? And how could we take this technology of systematically manipulating variables in the environment, and instead of creating these simulation settings where we try to replicate what happens in the child's natural context, what if we took this functional analysis technology and moved it right into the context? And so I started to do some research looking to see who had done work in this area. And of course, Jeff Sigafus had already started working on this in 1995. So I was late to the game. And he called it an embedded functional analysis, or a discrete trial functional analysis. And that model is now what we refer to as a trial-based functional analysis. And so a trial-based functional analysis takes that same logic of looking at antecedents that occasion problem behavior and reinforcers that might maintain problem behavior. But instead of doing this in a massed trial format, a trial-based functional analysis distributes those trials over time. So this actually might look more natural to what happens in the typical environment, right? Typically, an adult might present a demand, the child engages in challenging behavior, the adult removes the demand, thinks of a new game plan, represents the demand. At a later time, child engages in challenging behavior. So in typical environments, we really do have these distributed trials quite often. Another benefit of distributing these trials is that we can embed the functional analysis into ongoing activities or routines in the individual's daily life. So when is there a time in their daily schedule where adult attention is removed? Let's test for the attention function during that time. When is there a time in the child's schedule where access to a preferred object or activity is restricted? On a tangible condition during that time. So we're embedding the logic of functional analysis into ongoing routines and activities. We're still exposing the individuals to specific antecedents and specific consequences in a systematic way, but we're embedding it into typical opportunities for those antecedents and consequences. So this is maybe considered like a discrete trial, distributed discrete trial format. And we collect data a little bit differently. So because we're not repeatedly presenting antecedent behavior consequence in a mass trial format, a rate of behavior doesn't make sense here. So instead, what we often do is we collect data on the percentage of trials with challenging behavior. And that allows us to aggregate the total number of trials presented over a day or over a week, and determine what's the percentage of those trials in which the individual engaged in problem behavior. So again, a trial-based functional analysis takes place during typical instruction or routines. I say classroom here because most of the work we've been doing until very recently has been in classrooms with this model. It's a brief assessment, and some might think of this as a compromise between directly observing and not manipulating what's happening in the natural environment, and also doing some manipulation, but not to the extent that we're either having to simulate it in a different setting or repeatedly occasion and reinforce problem behavior in a short time frame. And we do know that trial-based functional analysis can provide us with clear data to tell us what the child or the individual is communicating through their problem behavior. So in a trial-based functional analysis, we have two components. The first component is the control component, and that takes place for 60. This is the model that we use. So let me back up. There are different models for doing trial-based functional analysis. This is the model we've been using for about 8 years. And there are other models out there that either flip the sequence of test and control or reverse the sequence. So like control, test, control, for example. So I'm just showing you the model that my lab uses. And so the first minute is the control condition. And this is where we're trying to turn off the challenging behavior. So we would call this an abolishing operation condition. So we're trying to reduce motivation to engage in problem behavior and reduce the occurrence of problem behavior. After 60 seconds, we move into the test condition. And this is where we're testing an establishing operation. So we're looking to see, does this environmental variable increase the motivation for challenging behavior, for the reinforcer that maintains challenging behavior, and then increase the frequency of that challenging behavior. And that test condition also lasts up to 1 minute. The great thing about a trial-based functional analysis is that as soon as challenging behavior occurs in that test condition, we reinforce it and the trial is over. So you could have a trial as short as 61, as short as 60, I get real choked up about trial-based FA, as short as 61 seconds. Or if you don't see any challenging behavior, the trial could actually go for a full 120 seconds, which is still a very short time. So I just will walk you through the logic of these different social conditions. So one is the attention condition and the attention control component. The adult might provide a high dose of attention for 60 seconds. And then after 60 seconds, the test component begins and the adult removes that attention. So in a classroom, we might look for an opportunity where the teacher is providing some one-on-one or small group attention to the child. And then the test component, maybe they go and talk to another group of students or provide whole group instruction. So we're looking for how do we embed this technology into ongoing typical events that happen in individuals' natural environments. The escape condition is the same idea. In the control, we don't have any demands, right? Child gets a break. And in the test condition, we start to present some demands. And we're looking to see, does challenging behavior occur in the control or does it occur in the test? Tangible condition, same idea. In the control, we're giving the child or the individual access to highly preferred object or activity. And in the test, we tell them time to put that away, or you need to share, or it's someone else's turn. And again, these are things that happen all day, every day in learning environments and in employment environments and in daily living environments. And so we're trying to capitalize on those natural events. The ignore condition is designed to assess whether the behavior is maintained by automatic reinforcement. And in the ignore condition, the control component and the test component are identical. So we provide no programmed stimulation and no programmed consequences for problem behavior in both of those components. So the ignore condition is always 120 seconds because we're not programming for problem behavior. We're looking to see, does it occur in the absence of specific antecedents and social consequences? So when we interpret the results of a trial-based FA, we first want to make sure that we've designed our trials in a way that control for the establishing operation, meaning that in the control component, we turn off the establishing operation, so we have the abolishing operation in place. And in the test component, we have the establishing operation turned on. So here are some examples of data, and this again is Lauren and Dennis, who had the functional analysis fail earlier. We then conducted a trial-based functional analysis with each of these individuals, and we saw a nice separation between the control component, which is the light gray bars, and the test component, which is the dark gray bars. So on the x-axis, you see the different social conditions that we assessed, and on the y-axis is the percentage of trials with challenging behavior. And we graph the occurrence of challenging behavior in the control component separately from the occurrence of problem behavior in the test component. And what we want to see is a nice separation there. That tells us in the control component, we turned off problem behavior, and in the test component, we turned it on. Or we saw what turns it on, rather. And so for Lauren, we see that she likely has challenging behavior maintained by both positive and negative reinforcement, primarily in the form of escape from task demands, but she also seems to have an attention and a tangible function to her responding. For Dennis, we don't see any challenging behavior in the attention condition, and we see high levels of challenging behavior in the test component of the escape condition and in the test component of the tangible condition, telling us that when we design an intervention, we're going to want to focus on escape and teaching him a better way to access preferred objects or activities. But sometimes when we conduct trial-based functional analyses, we don't see that clear separation between the control and the test component. So here's a study that we published in Behavior Modification in 2018. And what I want to draw your attention to is that in some cases, we have high levels of challenging behavior in both the control and the test, which tells us we're not capturing those establishing operations. What's interesting here with all three of these individuals, we were looking at a specific topography of responding, which was vocal scripting, so reciting movies or YouTube videos or portions of storybooks. And we see high levels of vocal scripting for each of these participants in the ignore condition. Well, we would expect that if the behavior is maintained by automatic reinforcement. We would also expect high levels of problem behavior to occur in both the control and the test components of the ignore condition, because recall, the control and the test components are identical in the ignore condition. So we're not too worried that we see elevated levels of responding in the ignore control condition. What is worrying is that we see high levels of challenging behavior in the control portion of the escape condition, and for Elvis in the control portion of the tangible condition. So this tells us that it's possible we did not fully control for those establishing operations. It's also possible that these individuals engage in automatically maintained vocal scripting that might occur despite social situations. And yet we see low levels of responding in some of those control components, which tells us that even if this problem behavior is maintained by automatic reinforcement, there seems to be some things in the environment that we can do to reduce that vocal scripting. For example, providing attention, which we see in the attention control condition, or providing access to a preferred object, which we see in the tangible control condition. So what we did here is we thought, okay, we're behavior analysts, and we don't just implement things as they're given to us, but instead we engage in analysis. And so what is it about these individuals and the design of their trial-based functional analysis that we might need to rethink? And so what I've done here for you is I have the standard escape control procedures at the top, and then I have the modified escape control procedures at the bottom. So what we did is we realized that when we're providing attention, we see low levels of challenging behavior. When attention is removed, we see higher levels of challenging behavior. And in the standard escape control condition, the child just gets a break, so they're not getting access to attention. What if we're actually assessing access to attention here and not really controlling for the absence of task demands? So we address that by pushing in attention. Child still gets a break. We're still not presenting task demands, but the adult can provide them with some attention during that control portion. And in the tangible portion, the teachers were recommending today he wants access to this cup. Tomorrow he might want access to this slinky or this other toy. So every day we were using different tangibles, which may also be influencing the motivation to access that tangible. So instead, in the modified version, we conducted a preference assessment, learned what the individual's most preferred object was, and that's the object we used throughout all of the tangible conditions. And when we implemented that, we saw reduction in challenging behavior in the control portion of the tangible and the escape, suggesting that we finally got control over those establishing operations. And we saw the same pattern again for the other two participants. So modifying the trial-based functional analysis protocol may be necessary if you're not seeing are not seeing differentiation between the control and the test components. The other lesson we've sort of learned through our work on trial-based functional analysis is how do you interpret these results? So traditionally, in applied behavior analysis, we use visual analysis, where we'd use repeated measures of data over time, and we plot them in a line graph. This allows us to look for things like stability in data, variability in data, change in level of responding from one condition to the next, and we can look at things like trend, so the overall decrease or increase in responding over time. When we graph results for trial-based functional analysis, we typically see those aggregated as bar graphs. Bar graphs are really wonderful tools for communicating overall pictures of data, particularly to folks who don't have a background in visual analysis. So there's a lot of social validity in using bar graphs when you're communicating with families or with teachers or providers who don't have a background in visual analysis of line graphs. However, one of the problems with aggregating data into a bar graph format is that we don't get to see the changes in responding over time. We lose that kind of molecular level of data analysis. And instead, we're just presented with a single time shot, right? So one moment in time, these are the percentage of intervals with challenging behavior versus look at what's happening over time throughout each of these trials. And so on the right-hand side of your screen, you see two line graphs. One says attention and one says escape. On the x-axis are the trials, and on the y-axis is the occurrence or the non-occurrence of challenging behavior in each of those trials. The control trials are for escape are labeled with open circles, and the test trials for escape are labeled in closed circles, and the same for the attention trials. What we can see in these graphs is that over time, we're not seeing any challenging behavior in control or test for attention, but we are seeing a nice separation of challenging behavior in the test component for escape versus the control component for escape. We also see that this pattern has held true with behavior in the test and not in the control for 4 consecutive sessions. That actually gives me a lot of confidence that if we were to conduct one more trial, I could predict that we would again see challenging behavior in the escape test and not challenging behavior in the escape control. So we did some work where we looked back at all of the trial-based functional analyses we've been conducting, and we compared the bar graphed data to the lined graphed data. So here's a tangible condition for one participant, and here's a tangible condition, same data, when we pull it out into a line graph. So if I were to look at the bar graph, I might say, ooh, I don't know if we've really controlled the establishing operation here. We shouldn't see this much responding in the control component. We do still see a little bit of a separation between control and test, but I'm not really confident in these results. When we just aggregate those data and plot them in a line graph format, we can see that there was a lot of variability in responding for the first 6 trials, and then the individual starts to learn the contingency and allocate their responding accordingly. So we see no challenging behavior in the last 3 control components of the tangible condition, and we see consistent challenging behavior in the last 5 components of the test condition. So using visual analysis, I'm actually quite comfortable with iteration of data, and I'd be ready to move forward and help design a support plan to address the tangible function. So in this case, the line graph gave us more information that would inform our treatment decision versus keeping us in this functional analysis loop for more time, trying to figure out what the function of behavior is if we were just looking at bar graphs. Here's another example, aggregated data versus pulling the data out. So here our bar graph looks pretty similar to the tangible bar graph, but if we pull out the data, what we see is a lot of variability and allocation of responding across both control and test components. So if I were to pull this out, I might say, okay, we need to continue to conduct more trials because I'm not seeing a clear separation. However, because it's the ignore condition, we would expect to see similar levels of responding in control and test because those components are identical. So perhaps the data we're seeing in both the bar graph and the line graph makes sense for this social condition. So in summary, one of the things to think about is, first of all, when you get trial-based functional analysis results that don't really make sense to you, make sure that you actually have controlled the relevant establishing operations in the natural environment for each of those different tests. Second is to look at the data and really evaluate it through visual analysis. Right now, we are only using line graphs in our lab for trial-based functional analysis. When we need to communicate those results after we've done the analyses, then perhaps we might share those in a bar graph format, but we're making those decisions based on our stakeholders and their needs and resources. And then there's been a lot of work trying to decide which functional analysis model is the right model or is the best model. And so what we often see is that researchers might conduct a functional analysis in one model and then conduct a functional analysis with the same participant, the same target behavior with a different model, and compare those results. What we're doing is, instead of comparing from one assessment to the next, we're evaluating the accuracy of our results by matching it to the treatment. So if our trial-based functional analysis suggests an attention function, we're going to design an attention treatment, and if it treats problem behavior, we can be confident that the results of our FA were correct. So I always advocate for confirming the results by matching it to treatment, because after all, that's what a functional analysis is designed to do. It's designed to help us create an effective and efficient behavior support plan to reduce problem behavior. So let's talk a little bit about efficiency and effectiveness. A functional behavior assessment can be a mysterious thing to some folks. Sometimes we use the same language and we mean different things. So when I talk about a functional behavior assessment, this is what I'm talking about. So the functional behavior begins with identifying the behavior of concern, conducting an indirect assessment where we might talk to stakeholders through interviews or rating scales to get their perceptions about why a problem behavior is occurring. We'll do some descriptive assessment where we go into the natural environment and we're just looking to see patterns of antecedents that might occasion problem behavior and consequences that might reinforce or maintain problem behavior. For some folks, that's the end of a functional behavior assessment. For other folks, that's not the functional behavior assessment and they just want the functional analysis. What we've been doing in pursuit of an efficient functional behavior assessment is adding a hypothesis testing component to our functional behavior assessment process. And we test our hypothesis with a trial-based functional analysis. So we're conducting a full FBA where we're getting indirect assessment, direct observation. We're coming up with a hypothesis. It looks like this individual might be communicating that they want to escape task demands. And then instead of designing an intervention and waiting to see if it's effective, or instead of conducting a full-blown functional analysis, which might again delay the onset of treatment, what we're recommending and what we've been doing is a trial-based functional analysis as a quick test for that hypothesis. That can tell us whether or not we're seeing the separation of responding and the test and control components of the function or functions that we're hypothesizing maintain that problem behavior. That allows us to be more confident as we go into designing and implementing the function-based intervention. It can also tell us, man, we missed the mark. We thought it was escape maintain behavior. We're not seeing that here. We're sure we're controlling the establishing operations. We're engaged in visual analysis, and we're still not able to support that hypothesis. So rather than designing a treatment for escape, let's go back and gather some more information. So when we're doing hypothesis testing in a trial-based functional analysis model, what we're doing is still conducting our indirect assessments where we interview those stakeholders and caregivers who have deep knowledge of the child or the individual and their problem behavior. We're still conducting direct observations, and we're using that data to develop a hypothesis. And our hypothesis, for example, might be attention maintained, escape maintained, or tangibly maintained problem behavior. Only for those conditions that are hypothesized to be functions of this child's behavior would we actually run a trial-based functional analysis. So if we think the behavior is maintained by attention, we might run a few trials of the attention condition or a few trials of the escape if that was our hypothesis, and so on and so forth. So what we've been doing is using the motivation assessment scale to help determine why, what others' views are for why challenging behavior is occurring. We're using the functional analysis observation form, which allows you to take ABC or antecedent behavior consequence data. And as you're taking data, it forms a scatter plot right on your data sheet. So it allows you to engage in some visual analysis at the same time that you're collecting data. It's a really, I think, useful and brilliant tool. And so we do observations for 2 hours across 2 days. And then we pull those results together to come up with a hypothesis, and that's what we test with the trial-based FA. So for example, if these were our ABC data results from the functional assessment observation form, we might decide to run a trial for demand. We might develop a trial for transitions. We probably want to run a trial for attention because we see elevated levels of responding, and we may want to run a trial for tangible, but that would be based on a team's decision. Versus if we saw ABC data that looked like this, we might conclude that we only need to test one hypothesis, which is access to attention. So we can run a single trial. So we have published on this model. So Emily Gregory has a paper coming out in Journal of Developmental and Physical Disabilities, where she trained direct support personnel for working with adults with disabilities. And she conducted a trial-based functional analysis as a hypothesis test. So you can see for these participants, she only conducted 2 to up to 6 sessions. So she used visual analysis of line graphs to help determine whether or not she felt confident with the testing of that hypothesis, and then she was able to move right into intervention. So with very few trials, we can get straight from functional assessment into function-based intervention. And when she implemented the intervention, she was able to just demonstrate that the function-based interventions reduced problem behavior and led to increases in appropriate communication for all 3 of these participants. Which leads me to thinking about, okay, if we know that we can distribute trials in natural environments, and we know that we can effectively identify the intervention that should be implemented, or at least the function of the behavior to lead to an intervention, and we know that we can do this in very few trials if we have a high quality functional behavior assessment going in, how do we help stakeholders and providers to implement this technology in the natural environment? So we know that there's a tremendous amount of data that shows that teachers feel unprepared in assessing and treating challenging behavior. We know that when teachers are unprepared, that can lead to a whole host of problems for assessing problem behavior, getting access to treatment, and making sure the treatment is going to be effective. What often happens is when teachers don't have skills in functional behavior assessment, we tend to only see functional behavior assessments implemented once that behavior reaches crisis level. In other words, we have so few resources of folks who know how to assess problem behavior that we have to wait until that problem behavior is at such a crisis that we can allocate our few resources there. Instead of using functional behavior assessment proactively to identify a host of communicative responses that we could be teaching to then shore up those skills and reduce the emergence or persistence of problem behavior. We also end up with providers who maybe don't understand communicative functions of behaviors, haven't been taught this or this philosophy, don't really understand the functional behavior process, and so they're not involved in it. And that means that we often rely on outside personnel. And when outside personnel don't really understand the culture of the school or the home or the classroom, don't really know the child or the teacher or their resources or learning histories, we can often end up with poorly conducted functional behavior assessments, lack of buy-in from stakeholders who don't understand the process or what we're asking them to do, lack of contextual fit between the recommendations made by outside personnel and the resources and values and needs of the folks in the natural environment. And when that happens, we might design a really beautiful plan, but no one's going to be implementing it. So we have failure to adhere to the behavior support plan. So getting natural providers, families, teachers, other service providers involved in the functional behavior assessment process may be a way to fix this issue. So we developed a model called STEP, or Supporting Teachers in Evidence-Based Practices Using Practice-Based Coaching. And I'm looking at the clock and I'm cognizant of the time. So I'm just going to go over this quite briefly and then we can move into some questions. But essentially what we're looking at are multi-leveled supports. So I couldn't do a talk about behavior and not have a triangle. So our multi-leveled supports are not for children in this case, or learners, or adults, therefore the providers themselves. So the way we've constructed this is that all providers get training in functional behavior analysis or functional behavior assessment or trial-based functional analysis using behavioral skills training. Those who might need additional support might get some practice-based coaching, which is one-on-one coaching in a model that I'll describe in a moment. And those who need even more support might get practice-based coaching with self-monitoring instruction as well. So our behavioral skills training just looks like written and verbal instruction, modeling, role playing, and performance feedback. We know that behavioral skills training is an effective approach to teaching new skills to adult learners. Practice-based coaching comes from the work of Pat Snyder and colleagues, and the focus here is on zeroing in on a specific practice, and that's at the center of this model. And in our case, the practice is trial-based functional analysis, or perhaps functional behavior assessment more broadly. And in order to make change in that practice, we begin with developing a collaborative coaching partnership between the coach and the coachee. So this is based on joint decision-making, minimizing that power differential between the coach and the coachee, helping us to develop rapport and trust so that we can come together to engage in shared goal and action, focused observation to see if we're on track to meeting that goal, and then reflection and feedback. So thinking about what we're seeing through our data collection and those focused observations and making the needed changes to help us reach our goals. I'm going to skip through here other than to say I do have all of these coaching materials available. You are welcome to review them, to use them. And so there's a link here, which I think should be accessible. But you are also welcome to email me and I can give you access to these materials. So the first thing we do at this level of support for providers is we conduct a needs and strengths assessment. So we help the providers to think about what do they know, what are they comfortable with, what do they not know, and what's a priority for them with respect to functional behavior assessment or function-based interventions. We take those results of that needs and strengths assessment and we develop, and this is our very simple goal planning form. And now the coach is not developing this and handing it to the provider. The provider is in the driver's seat and the coach is there as a facilitator. So the provider is saying, okay, I did some thinking and reflecting on my strengths and needs assessment. And you know what? I'm really good at ignoring problem behavior. So I think I'd be really good at the attention test component. Or what's really hard for me is representing the demand. And so I might need some supports in the escape component. And then they think about it, what they want to prioritize that week. The next step is action planning, where we take that goal and we help the teacher or the provider to think about what they need to be able to reach that goal, what challenges they might have and how to overcome those challenges, some antecedent planning so they don't get stalled out or stuck. And again, the coach's job here is a facilitator and a guide, not as someone who's doing an approach of here's what you're going to work on, here's the materials you need, and so forth. We're really trying to promote self-instruction through practice-based coaching. And we conduct focused observation of that practice. So in this case, the trial-based functional analysis. And we use those data to reflect and offer feedback so that we can begin to think about what next steps might need to happen. And so that's what our practice-based coaching model looks like. And then for practice-based coaching plus self-monitoring, we do the very same thing, but we're also teaching the provider how to self-monitor their own implementation. And we have a lot of data to suggest that teacher self-monitoring is an effective approach to changing teacher behavior or adult behavior. So we implemented this model with everyone gets behavioral skills training, and we check to see how you're doing with your trial-based functional analysis implementation. If you need more support, we provide practice-based coaching. If you need even more support, we provide practice-based coaching plus self-monitoring. So in other words, when we're training others to implement these protocols, we're individualizing our training. So we're not just saying, this is the program, use it or lose it. This is the program, and if you need more support, here's what we can do next. So we're differentiating our approach for adult learners, which is something we do all the time for children. And so we're just applying the same logic for adults. And so I'm just going to share with you quite briefly some of our results. So this is a multiple baseline across preschool teachers. We taught them how to implement each condition of the trial-based functional analysis. First, they had baseline, where we didn't teach them how to implement it. We just said, assess problem behavior. Then we had behavioral skills training, and we see a little bit of an increase in implementation, but there's still quite a bit of variability in implementing this attention condition. We implemented practice-based coaching for those who didn't reach criteria. And for those who still didn't reach criteria, we implemented practice-based coaching plus self-monitoring. And so we had 3 teachers who, with behavioral skills training plus practice-based coaching, were able to master the attention condition. We call that level 2 supports. And we had 2 teachers who required practice-based coaching plus self-monitoring, which we call level 3 supports. And when we look at the other trial-based functional analysis conditions, we see the same responding. So the same teachers needed level 2 supports for all the conditions, and the same teachers needed level 3 supports for all of the conditions. So in summary, our lab is advocating for this model of a functional behavior assessment with hypothesis testing so that we can get to intervention and be more confident that the intervention is going to be successful. We are advocating for trial-based analysis as a way to conduct that hypothesis testing. It's efficient, it can be implemented in natural context, it does require training, and we are still collecting data, but our preliminary data suggest that multi-leveled supports for training are appropriate. So I've been pushing the trial-based functional analysis model here, but I just want to make a huge disclaimer that we begin with the model that makes sense for assessing behavior, given the topography of problem behavior, the intensity or magnitude of that problem behavior, the context in which that problem behavior occurs, the resources, the stakeholder views and values. All of that comes together to help us decide what method of assessing problem behavior makes sense here. Regardless of the approach for functional analysis that you're using, if you use a functional analysis approach, you want to make sure that you are effectively controlling establishing operation in your assessment, so that in the control component, you're minimizing the value of reinforcement, therefore minimizing, hopefully, the occurrence of problem behavior. And in the test components, you are maximizing the value of what you are testing to see if it's a reinforcer, and therefore increasing the likelihood that problem behavior would occur. We are evaluating our data through visual analysis. Bar graphs are great for communicating results, but I really advocate for using visual analysis with repeated measures, where we disaggregate those data into trial by trial data. And that allows us to have an efficient and effective path towards treatment, which is the whole point of functional analysis, is to get out of the analysis and into the intervention as fast as possible. And so we confirm our results by matching those results to an intervention. This is my email address. That was a lot of information. I think I went pretty quickly. So if you have other questions, feel free to reach out to me. Trial-based functional analysis is my perceptive interest, so I'm happy to engage with you to talk more about that. Thank you so much. And I do believe we've got a few minutes for questions, so I'll stop there.
Thank you so much for that. That was really interesting. I loved all the data, and I really like the idea of using the trial-based functional analysis as hypothesis testing. And you made a very good point about using the functional behavior assessment as more of a proactive approach rather than a reactive. It's really interesting. We do have a few questions at the bottom here. Someone did ask whether the recording would be available afterwards, and it is available on Behavior Live. If you have registered for the event, it should be available in your library. Once the recording has been uploaded, it should be available later. Then we had a question from Sophie. She wants to know why 1-minute conditions for the child-based functional analysis, and what different links do different practitioners use, and is there any research to show which condition length gives the most accurate results?
Great question. So the first part was thinking about
why
the
1 minute. Yeah, so why 1-minute conditions for the child-based? Yeah.
Right. So we use 1 minute because we've been able to identify the function within 1-minute components. However, you want the trials to be long enough that the individual has an opportunity to feel the establishing operation, right? So if our trials are 15 seconds, that might not be long enough for an individual to recognize that attention has been removed or that task demands are being presented. And so you want the trial to be long enough for the relevant antecedents to be actually to have an opportunity to evoke problem behavior. Some folks advocate for 2-minute components, and that may be necessary for some learners. They may need that duration to really feel the effects of an antecedent. For most of the kids that we've worked with, and I shouldn't say kids, 90% of the participants we've worked with are under the age of 14. We do have a couple papers out with adults with developmental disabilities. So I say kids as a habit, but know that this is for all individuals. Some of those individuals may need longer time periods to experience those antecedents, but for us, we've been able to successfully manipulate the establishing operation in just 60 seconds. Likewise, in the test component, you may have an individual who can tolerate several demands, maybe up to 30 seconds. But once we get closer to a minute, then we're going to start to see that establishing operation take hold. You may have a learner for whom challenging behavior happens, but it happens at a longer latency from the onset of the antecedent. And so for those individuals, you might want to have a longer trial, or perhaps a trial-based FA is not the right approach and you want to take a latency approach instead. So we engage again in thinking about what are the needs, what are the learning histories, what are the patterns of responding for these individuals, and use that to help construct the structure of our trials. And then the second part of that question, is there research to show what condition length gives more accurate results? So I think there you're also talking about the duration. And I think we've seen that 1-minute trial components are effective. I think we've seen that 2-minute trial components are effective. So we have a lot of different data out there. I don't know that we've seen any data that are less than 60-second components. So that's not something that I'm familiar with. So I think we're trying to go as fast as we can to help get folks into intervention. And so we found 60-second components to be sufficient. Great question.
Okay, great. So then we have a question from Nadia. Do you or your teams, particularly those working with adults, ever raise concerns about the ethical implications of implementing strategies, conditions that we believe can increase the behaviors? And how do you address this if you do?
So that's a common concern we hear from stakeholders about functional analysis is, so wait a minute, you're going to occasion problem behavior and then you're going to reinforce it. Isn't that the opposite of what we want to be doing? And yes, so functional analysis is a tool to get to intervention where we're reinforcing appropriate responding and not problem behavior. But because children or adults are referred to us or to whoever because they're engaged in problem behavior, we know that something already in the environment is occasioning and reinforcing that problem behavior. So what we're trying to do is capture those variables to see what's happening. We're not trying to create new variables. And so the benefit of a trial-based approach is that we can look in the day and say, okay, here's an opportunity where the teacher is already naturally presenting the antecedent, which occasions problem behavior, and the teacher is already naturally reinforcing that problem behavior, right? Perhaps unintentionally, but the child's removed from instruction, negative reinforcement. The child is given a reprimand, positive reinforcement in the form of attention, possibly. The child is given access to continued time on the playground when they don't want to come in, or access to computing devices that they find highly reinforcing. So this access to reinforcers for problem behavior is already happening, which is why we have a problem. So the functional analysis just allows us to zoom in and get a picture of what's actually happening right now, and then moves into support so that we can stop that from happening and change those contingencies so that appropriate responding, appropriate behavior gets access to those reinforcers and challenging behavior no longer does. And a lot of that ends up being changing provider behavior so that they are the ones who stop reinforcing those problem behaviors.
Okay, and then we have another question. I have a question about the ignore, control, and test condition. As the two conditions are identical, why is it necessary to have the two conditions?
Great. So it's really one long condition for 2 minutes because there's no separation between the control and the test. I plot it out that way just to show the logic is consistent across. And again, here we're looking to see the relevant effects of the establishing operation. So for the ignore condition, we're testing to see if behavior is maintained by automatic reinforcement. And so 60 seconds is not enough of a time for an individual to seek out automatic reinforcement, but perhaps 120 seconds is. In other situations, we might see automatic reinforcement occur immediately. We want to then make sure that our conditions are the same duration so that we're not artificially inflating responding in the ignore condition when all of our other conditions are 120 seconds up to. So that's why we have that same kind of logic there. But you're right, the control and the test are identical.
Okay, we have two more if you're okay for a few minutes. The next question from Denise, how often do you find that your treatment plan needs to be changed due to a lack of match to the trial-based FA?
Gosh, that's a great question. And I think that's an empirical question, which means that I think that's an answerable question that we don't have an answer to yet. So in our lab, our trial-based functional analyses have always led to an appropriate treatment design. Sometimes we have to add components to that treatment, but they're still function-based. So we've not yet come up with a false positive for a function. In other words, our trial-based functional analysis has always identified at least one function that can be treated with treatment. One of the downsides of the hypothesis testing approach is that we're only testing the function that we hypothesize maintains behavior, which means we might have some false negatives, right? So we didn't test escape. So we might conclude that the child doesn't have escape maintained behavior, and we can't draw that conclusion. We didn't test escape, so we don't know. What we do know is that the individual engages in attention maintained behavior. And so our intervention focuses on that, which tells us that our intervention may be effective at reducing problem behavior. But if they also had another function, then we might need to layer that function into our treatment plan to eliminate problem behavior all the way. So that's a question that we need to keep looking at with this model. It may help us begin treatment, but it may not allow us to develop a full comprehensive treatment plan for individuals whose behavior is multiply maintained. I think it also has to go back to how you're designing your trials and your functional behavior assessment. So we are not just doing trial-based FA, we're doing indirect assessment, direct observation, and then thoughtfully individualizing the construction of a trial-based FA for those individuals. So if we're just coming in and doing trial-based FAs without any of that background information, my guess is it would be interesting to see if our functions are as accurately identified, which would have implications for treatment. So that's a good research question.
Really quickly, during the control condition, is the therapist near the child? During the control, for example, control condition for the tangible, is the therapist in the same area?
So we always have the adult, whoever that is, in this proximity to the individual, and we do that for ethical and safety concerns. So our lab does not run any alone conditions. We just do an ignore, where we might not be attending to the individual, but we're right there. And so there is some proximity, but typically what we do is we have the individual either walk away into another section of the room, turn their back, really signal the elimination or the removal of attention. So orientation of the body, orientation of the eye gaze, and then no vocal speech or physical touch when we're removing attention in the attention test condition, for example.
Okay, and then our last question from Emma. When concerns arise regarding controlling establishing operations and considering modifying conditions, in the case, why would you continue with the trial-based functional analysis as opposed to moving to an ISCA?
So I think the question is, when you're starting to get cloudy results that aren't clear, why would you modify the approach you're using versus when would you go and select a different functional analysis approach? Which really gets at this decision-making rules for how to conduct a functional analysis and when to move from one model to the next versus when to keep tinkering with the model you're using. And so there are some folks out there who are developing decision-making models. We have one in our lab that we use. We haven't published on it yet, but it's usually within the trial-based functional analysis. I think if you're seeing that your trials are not capturing problem behavior, so you're not seeing problem behavior in control or test, one modification you could do is extend the duration of each trial to try to really capture that establishing operation. If that's not sufficient, then then it may not make sense to do a trial-based approach, and you may need more of a massed or repeated trial opportunity. Or if you have a really low rate behavior, then maybe a latency functional analysis makes more sense. So I think those are case-by-case decisions, but if your center or your school or your agency wants to develop a data-driven kind of decision-making guide, I think that's a really wise thing to do, and there are some folks who've published on that as well.
Okay, well, I think that is everything. Thank you so much for your presentation. It's very interesting, and for quite everyone in the talk, everyone was commenting on how awesome the data was, and thank you for sharing your slides so everyone can go back and look at those later, and for the link as well. So having all the materials available. Thank you so much. And thank you for coming, everyone.
Bye, everybody. Thank you.